agent-based model to simulate COVID-19 spread in Hong Kong using secondary data and demographic and travel characteristics. So please welcome Mr. Ko and Mr. Tang.
Okay, good morning, good afternoon, and good evening. This is Peter Ko, and then this is Ken Tang from University of Hong Kong. So today we will present our latest work on COVID-19 spread disease, the model built in the AnyLogic, and then we studied some kind of the potential outcomes of the interventions. So today's contents is this. So we will briefly introduce some background and our methodologies, and then we will share some of our results, and then we will have some short discussion with our results. Okay, so the Hong Kong, probably some of you visit in Hong Kong, that Hong Kong has quite unique conditions, especially in terms of the COVID-19. The first one is its hyperdense urban environment here. So as you can see all the apartment and the residence buildings, and then offices are really, really high rising. So which means they may have some kind of the different approach to modeling the disease spread model in Western urban context, and then in Hong Kong's context. And then also Hong Kong is a major transport and then logistic hub connected to all around the world. And then the one of the interesting is this the Hong Kong is economic engine for the main the here and Eastern Asia and the whole the global economy. As you can see here, how where the addressing COVID-19 is really important for their economy. As you can see here, this is their unemployment rate changes within last 1 year. So before the COVID-19 is only 3% of the unemployment rate, which is totally the perfect situation. But during the times, their unemployment rate goes to like 7%. So it could be a really, really economic kind of disaster for the Hong Kong. And then, as you already know, that Hong Kong has some kind of political changes in here. So sometimes government interventions is not properly working to the people, because people are now losing their the reliability to the government in terms of everything. And then the final the condition is this one. So as you can see here, everyone wear the mask, and then these kids, wash their hands. This picture is actually not from this COVID-19. This is the 20 years ago from the SARS, the epidemics in Hong Kong, 2002 to 2004. So Hong Kong have this kind of the bad memories of the infectious the disease. So they're really, the worrying about the infectious disease, the spread here. So this 5 is kind of unique conditions of the COVID-19 compared to other parts of the world. So during the last 18 months, the Hong Kong government did lots of the non-pharmaceutical interventions, like mandatory wearing masks and social distancing. This is all similar to other areas. The one noticeable difference measures like these two, they have still very strict quarantine measure for inbound travelers. So still, if you are staying in the United States, for example, so you need to be have 21 days of the hotel quarantine here, and then they on and off they do this compulsory testing for whole certain area or certain the apartment when you find one infection in the neighborhood. And then they also do the pharmaceutical interventions like the vaccinations, so which I will share more later. And then this project is we are building up the agent-based modeling to simulate the COVID-19 situation, and then the interventions, the effectiveness of the interventions to the Hong Kong's the unique the situations. So we're just making a three-dimensional the model framework to the simulate the Hong Kong's universe unique the infectious the conditions. I will talk a bit later. Okay, so this is the data we used. So one data is this one, the Hong Kong Travel Characteristic Survey, which is the government, the data, which usually collect by every 10 years. This data set have very important informations like age, gender, occupation, and also they have the patterns in there when they start their trip from here to there, and then what is the trip purpose, okay? And then have the geographic informations, which is the street block identifier, the numbers. Okay, so we can use these things making the model. The reason why we use this model is this data is accessible, and then this is quite having the variety of the informations in there. Yeah, this is the time of the big data. So many other studies using mobile phone data and some other big data sort of things. Yeah, which is really good if we can use that the kind of the data. But as you know that in academia, we are usually relatively limited resources, and it is very difficult for us to to connect the industry to have that kind of information. So that's why we use this government data to model our process. So yeah, this picture shows that the data structure. So this is a timeline of the one day, and then it has lots of the details of the travel destinations and the time and etc. And then the other data we use is lots of the point of interest data, like the exact location of the shopping mall, supermarket, restaurants, and workplaces, whatever. And then we also using the building data and then COVID-19 patient data. All this data from 2 to 4 is from the government data too. And then yeah, we will explain more details about our model strategy. So as already said, that the trans characteristic survey data from the Hong Kong government, they have the geography information, but that information is only the street block, the ID number. Okay, so then it is difficult to have more, the small level analysis, and then that small level analysis is really important when we building the infectious disease. So what we did is actually we identify the whole the buildings the purposes. So this is a residential building, this is the commercial building, which is serving for the restaurant, or the education and whatever. And then we generated random point in the residential building, which is a kind of proxy of their exact location of their home. And then the random point in the commercial building is we can use like the proxy of the workplace or restaurant and whatever the travel destinations. And then what we did here is we consider the building height. So basically, many other studies out there, they do the agent-based modeling for COVID-19, which has 2D frame. So they have lots of the XY information there, but it is 2D. In our data, we actually put the agent in different layers, different floors of the buildings in here, so that we can avoid the over estimations of the disease transmission. Yeah, and then the travel characteristics, we just using the trans characteristic survey data. And then the one last thing we did is actually we made a kind of the buffer like this from the exact destination area. So for example, this dot here is actually exact at the central locations of the restaurants. So then we made a like 20-meter buffer or 50-meter buffer, following the data structure, then we can think that this circle is like really one, the individual restaurant or one individual workplace or something like that. Okay, and then this is our model, details in here. In agent, we have two agents, which is a mobile agent and the other is a static agent. So static agent is which is usually old generations who will staying there most of the time in their home. This mobile agent is more younger generations who are going to schools and workplaces and whatever. And then the major locations are like workplace, school, and grocery and shopping mall and restaurant. These four the destination occupy almost 95% of destination from the data, and then the another 5% is like going to the church or some other or park and something like that. This is a mobility pattern. So mobile agent will go somewhere here to somewhere there, and then during this the mobility processes, if they get infected, they will go to the hospital. And then for the static agent, they're staying most of the time in the home, and then if they got infected from their family member or some neighborhood, then they will go to the hospital for the treatment. And then we used extended the infectious disease model, which is susceptible, exposed, infectious, quarantine, and recovered model, SEIQR model. And then we assume that the cross contact could be happen within 2 meters, and then the air transmission will happen following this model, the Wells-Riley model, which is explaining here. So basically, the distance of the host and then susceptible population is matter, and then also how long they stay in this same locations, and then and then the ventilations is also kind of important, the parameters which decide the infection probability. So this is an example of the infection, the probability in the restaurant cases. So as you can see here, this is the distance from 0.1 meter to the 2 meters, and then we have how many people in there 1 to the 6. And then how many times they can stay together, like 30 minutes and 60 minutes. And then in each cases, we have different probabilities in the model there. So then, we, use, all the parameters from the literature or government reports. We first use mostly from the Hong Kong or mainland China or East Asia studies first, because our environment setting is more similar at that areas. But if we cannot find good resources, then we also refer to other international studies. So as you can see here, this is the basic structures. When you are just healthy in the community, but you have the contact, then you can be the symptomatic patient or asymptomatic patient. In that cases, you have some different stories going to have the severe condition or moderate conditions, and then go to the hospital and then recover or death. And then you can see here, this is all the parameters we are captured from the literature reviews. And then this is the example, the videos of modeling in here. So as you can see here, there are so many the parameters in here, the immunity duration and contact distance. We can adjust if we need to have another the scenario analysis in there. So then the result will be calculated and displayed in the graph, and at the same time we can also download the result in the Excel form using the AnyLogic functions. And then this is the result. What we use for the scenario analysis is the first model is the M0 model is the default model without any interventions. And then M1, the first model is the work from home. So we assume that 50% people will staying at home for work. And then M2 is the face mask innovations. So 80% people will wear the mask, and then the protective level of the mask will be 65%. And then the M3 is we will have the vaccination. So 70% people will get the vaccine, and then the vaccine will have the 70% of the efficacy level. And then M4 is we implement all that M1 to the M3 model like that. The total population number in here in our model is 10% of the whole total Hong Kong population. The reason why we use a 10% is we just want to have more speedy model in the model running, but at the same time we will have enough number of the infections in the model. And then number of the point of interest is 200, almost 250,000. The model period is 1 year, and then the average model running time for each model is like 6-7 hours for each. And then this is the result, as you can see here. So without any the interventions, almost 30% people will get impacted. And then, as you can see here, different interventions have definitely different the effectiveness. If we have the vaccine, definitely we don't have any problems. But the work from home and the mass cases, still we have the problem. And then, as you can see here, all this depot model, and then the work from home, and then the mask model, actually we will have the second wave after the immunity times is run. We said that we assume that after COVID-19 they will have the 7 months of the immunity, the duration. So so that's that. And then this is the vaccine, and then all the things. And then our analysis, we can go more details in the geographic level. So this is the kind of district level, which is kind of you just think about this is a like county level, or like the more larger level of the unit of geography in your the cities. So we can find like this area is kind of risky area for the infections, but at the same time we can calculate the result in this specific the lower area, the street block. So we can have very different scales of the result can generate in our analysis. So this is the whole different type of the interventions and different type of the geographic spread patterns of the COVID-19 in Hong Kong. And then we also generated age and the gender groups, the infection levels like this. And then we also calculated the RT, the reproduction numbers during the time in the model. Okay. So, what we can find that is actually the 3 high-risk districts is the Yachimong, Central West, and Wan Chai, which is really, center of the commercial and then, the business area. So how we can, address this area in the very first times of the infection times will be very important. But at the same time, Hong Kong government wanted to relocate that kind of the area to other areas. So maybe sometime later, when their job relocations happen in here in Hong Kong, that probably the transmission pattern may change. Okay, and then the effectiveness of the intervention, definitely if we have all the intervention should be best, and the vaccination is the second and then all the other models like that. So, but the thing is, without the vaccination, it is very difficult to go back to the normal, actually. But, as you already, they observed that there are so many issues about the vaccine efficacy, the availability and hesitancy issues. So maybe we can model more with this kind of issues in our modeling data. Okay. Yeah, this is the same thing. So we just want to see. Yeah, so just wrapping up, our the model is quite good because we're just using the public available data in this Bayesian-based modeling strategy, and then we collect lots of the data out there, in our model, and then our model is really, really realistic because we are using the government data track pattern times, and at the same time, we have the 3D the structures in our model. But the limitation is actually we didn't consider that infection may not happen during the transiting times in the subways and bus. And then, the data may be, you may all think that this is outdated data because it is collected every 10 years, right? And at the same time, the validation issues is also big issues because, during this whole times, Hong Kong has so many different innovations unexpectedly, this month and that month. So it is very difficult following all that we already in the model. But anyway, we actually show some probability that using some public data and then, making this model, the COVID model in here in Hong Kong. But the future direction is, then how we can, obtain other types of the data, how we can incorporate data in the Asian-based modeling should be another directions for this type of the study. And then we may also think of more geographic approaches in this, disease interventions across the world. And then maybe we can also think about some other hybrid modeling strategies like incorporating, system dynamic and then district event models in, certain buildings or some hospitals, something like that. And then, as I mentioned a little bit that, Hong Kong has some kind of urban, the social changes like population aging, gentrification, job relocations. So then how we can model that the kind of the mid long-term urban changes in here in disease modeling might be another research topic we may think about that. The final thing I can just reiterate is actually we may need some participative modeling. So for our work, we just working by ourselves. But if we have working together with more the fields, the specialists from the public health, and then if we can incorporate their idea or their data in our model, then definitely our model could be more reasonable, realistic for the future interventions. Yeah, so this is pretty much it, the reference. Okay, and then, thank you for listening our presentations. Okay, so back to you, and then I will expect some question and comment for our presentation. Thank you. Okay, so now I can. I'm checking the comments and questions from the floor. The first question in here I can see is that our result was shared with the government or decision makers. Unfortunately, no. So we are now trying to writing some report, and also we are to making some kind of quick toy model type of the website so that we can share more result to other people. And then yeah, so our mode, and then the result, we said that it's actually if we only do the face mask the interventions in the community without any other the interventions, then maybe it will take quite a longer time to get over this COVID-19, and then. Yeah, this kind of analysis can definitely we can have more better efficient vaccination strategies for later part. But in Hong Kong, we are relatively quite small cities, so probably the government may not that interested in these things. Yeah. And then, no, I don't think, yeah, there is no other questions.
All right.
Okay.
Thank you. Thank you, Peter. Thank you, Ken. Outstanding presentation, obviously very timely. We're really looking forward to your future continuation of this work and so on. Yeah, and possibly sharing some of this model. This would be great for a lot of other people and facilities to be researching. Thank you very much for your time and sharing your information. Thank you. Bye. Okay, so we've got a few minutes. Need to take a quick break. Our next presentation will start exactly top of the hour, and we'll be back shortly.